Hi, I'm Matthew Hersberg, and this is the Myopia Mindset. In this episode, we're going to be going into everything about the Myopia Collective. And I have to preface this episode by saying this is not a sponsored episode. I've received no compensation from the Myopia Collective, and I was just simply interested in everything that they're doing. Wanted to know more, and they were super happy to come on the episode. We had a great discussion, one that I enjoyed so much, so I've decided to make this entire episode available to everyone. And if you enjoy this episode, don't thank me, thank the growing number of paid supporters who have backed the Myopia Mindset on our Substack, myopiamindset.substack.com. This is a great episode. I can't wait to share it with you. So let's get started. All right, it's time once again for the Myopia Mindset. This is your weekly dose of education, motivation, and inspiration on your path to success in myopia management. And this episode is one I've been wanting to do ever since I first started the podcast again, which is all about the Myopia Collective. Carrie and I talked about it very briefly, and I wanted to delve into it more. And I have with me two change agents from the Myopia Collective, and I have Justin Kwan is here with us. So I'm going to give a brief introduction. So Dr. Tiffany Martinez is a change agent of the Myopia Collective. Like I just said, she is an optometrist practicing in New Mexico, specializing in family care and pediatrics. And we also have Dr. Shelby Johnson. She is an associate clinical professor and section chief of pediatrics at SUNY College of Optometry. And of course, we have Dr. Justin Kwan. He is the head of myopia management at CooperVision, who is partnering with the American Optometric Association, which is the driving force of the Myopia Collective. Shelby, Tiffany, and Justin, welcome to the program.
Thanks, Matt. Good to be on.
All right, Justin, we're going to start with you because this is a combined effort from CooperVision and the AOA. So give us the quick elevator pitch for the Myopia Collective. What is it and what is its mission?
Yeah, so a couple Decembers ago, Dr. Michelle Andrews and I went to the AOA Board of Trustees and said, what can we do together? Because it feels like each day there are not enough kids with myopia being treated by the profession at large, and it is a team effort. So just all the estimates of the number of children we could help is in the 19.5 million range in the United States. So clearly it's too big of a problem to be just a specialty. We've always said it has to be primary eye care, and CooperVision alone can only reach a few tens of thousands ODs. We need a stronger driving force. And what better way than to do it collaboratively with the American Optometric Association? So a year ago, April, we launched this groundbreaking initiative that you alluded to, Matt. The Myopia Collective kicked off. Then we took some change agent applications around May for Myopia Awareness Week. And we wanted to add to the membership as strongly and as consistently as we could over the past 12 months here.
Yeah, I love everything you're saying because back when I was the executive director of the AAOMC, it was very, very apparent that we needed all hands on deck for this problem. Everybody needs to be working together. We can't afford to put up divisions. We have to start collaborating. And that's one of my favorite things about the Myopia Collective is the collaborative approach, the initiative from both CooperVision and the AOA in order to make this happen. And you took applications for change agents. So I'm going to throw it over to Tiffany first. Why are you a change agent? What interested in this? Why did you apply for it? Why does this matter to you?
Yeah, I'm like, if you ask anybody, I'm usually the last one to get involved in anything like this because it's not my jam. And I was like, I found it and I was like, we should do this. You should do this. She's like the president of the NMOA. She likes this stuff. And I was like, she's like, you should do this. And I was like, oh, I should. But I started doing myopia management in 2017 when I graduated in school. Like, they didn't really make it sound like we could actually do anything for these kids. And then I met this doctor from New York and he was like, you could do this. And at that point in time, for me, it was just ortho-K. But I was like, oh, you mean it makes a difference? well, I love kids and I would love to help their myopia. So if it's going to help them, like I'm all in. I like basically put myself through a contact lens residency so I could learn how to fit ortho-K lenses. And since then, like, so I got the application and I was like, this is cool. We can collaborate, it'll be so much better than trying to do it by myself.
Right. Yeah. All hands on deck, all of us working together. And you mentioned, in the school system, Shelby, that's one of the reasons why I wanted to have you specifically on this episode, because you're at SUNY, you're working with students, you're working with pediatric programs. So same question for you. Why are you a change agent and what does that mean for you?
Yeah. So I'm really proud of the clinic we built up at SUNY, but I got my start I went to Berkeley Optometry for OD and for residency. I did a pediatrics residency. So compared to a lot of my colleagues in myopia management who have more of a contact lens background, I have, pretty much straight peds background. But thankfully at Berkeley, I was able to work under Dr. Maria Liu and learned a lot about myopia management. And I thought it was going to be my least favorite clinic during residency. And I was like, after 6 months, I'm going to switch out of it. I'm going to, focus more on peds. But then I ended up really loving it and the impact that I could, see in kids just over the span of 6 months to a year. So when I got to SUNY in 2018, after residency, the myopia clinic was fairly small at that point. So it wasn't until about 2021 when I was able to get into the clinic myself. And now as chief of pediatrics, myopia management also falls under peds. So that's really nice that I get to kind of steer the ship in that way. But yeah, one of my main things with students is really just trying to make it as accessible and making them realize, like, you go into any kind of practice, you're able to do it. It doesn't need to be this big to do. It doesn't have to be a specialty. You don't need to get extensive experience. Any little thing really can help. And so I think that's a really nice, I sit the students down at the beginning of the quarter, how can I help you implement this in your future clinic? What do you really want to learn from this? If you don't want to do, call the consultant for ortho-K lenses, we can figure out a way to, what other modalities could we do for this patient? So it's really impactful and it's very popular amongst our students, which, is really exciting to see. And I wish every student got to rotate through that clinic. We're not quite there yet, but hopefully one day every student will get that experience.
And what do you think, what will it take to get to that point where every student has the opportunity to rotate into that part of the program?
More providers doing it. I mean, we have, multiple that do it, but having, really getting administration on board that this is obviously it's a nice, able to make the clinic money because it is still out of pocket. But that just the impact that it makes and the desire of the students. So as we have more and more patients that learn about it, they're coming into the clinic, we have a longer and longer wait time. So, just getting administration on board really and showing them that we need to keep expanding until we're able to get everyone in there.
Yeah, definitely. Students are faced with so many obstacles as soon as they come out of school. A lot of them or most of them are faced with debt. And the prospect of a private practice is getting farther and farther away. I grew up in an ortho-K practice. My dad was the doctor. My mom was the office manager who brought it all together. And I feel like, hopefully not, but I feel like that era is kind of, we're getting farther and farther away from it. So any way that we can encourage, up and coming, docs, students coming out of optometry school to get interested in myopia management. Tiffany, what can myopia management do for, your practice? And, as Shelby mentioned, we need to get more practitioners doing it. How is that a priority for you as a change agent in the Myopia Collective?
Well, when Justin was talking, I just had this huge aha, like just the way he said it, it's like, we need to take it from a specialty to part of what we do. Like that was like this big, like, oh yeah, it shouldn't be a specialty. Like this should just be how we treat patients. Like you have myopia, this is not normal. Let's do something so that it doesn't keep progressing. Like, so I think that that's how we need to treat it. I think it's like, it shouldn't be like you have a clinic and you have this long wait list. It should be like every patient that comes in. And, Justin, I think this is why he had wanted me to be on here, because I had said, well, I used to do like a consultation And I had the whole thing like, come back, we'll do a consultation, we'll talk about this. And I just find myself just so much more organically now talking to parents and being like, hey, listen, like, here's this, here's what we can do about it. Here are your options. What do you want to do?
Mhm.
And then I thought, right?
Yes.
Like, I'm not trying to like sell them anything. Like, I truly believe in what we're doing and that it's impacting these kids. And I've been doing it now for long enough, like 8 years, that I have lots of kids who have gone through my program and I can see how impactful it can be, that I'm like, no, like this is what we do. Yeah.
Right. Yeah. And I think so many great things that you said, just about knowing when to present and then when to stop. I think there's so much pressure just to blast, the parent with information. And I think that there's a symbiotic effect in our industry with practitioners where, in the early days, a lot of words got thrown around like, if you're not doing myopia management, it's malpractice, or you need to be serving the best interest of the patient, and that's by doing myopia management. But Justin, not every OD should be doing myopia management. There's plenty of other specialties out there, quite frankly. I've been a huge fan of Cooper Vision getting into myopia management from the beginning. And what is part of Cooper Vision's efforts, especially through the Myopia Collective, to spread the word? What does that look like? Because, the clinicians can talk about it till they're blue in the face, but it really does take a big push by major industry in order to make that happen.
Yeah. So certainly Cooper Vision's marketing department always invests millions to educate the public through direct to consumer. But really our power, again, is through all the ODs together. So with the Myopia Collective, even if you haven't become a member yet, you can go to the website and access resources on the AOA's page under the Myopia Collective, whether it be letters to pediatricians or social media posts. We also have this myopia fact sheet that doesn't have my side or Paragon CRT on it. It's really just a clean, non-product thing that can educate any person. And I also wanted to mention that even moms and dads, like parents, can be members of the Myopia Collective too. Staff members, technicians, office managers, you name it. But we do, of course, prioritize right now optometrists and ophthalmologists joining the collective.
Gotcha. So the objective then is to, create streamlined resources, keep it simple and straightforward, because I know that's a big part of Cooper Vision's approach to talking to parents is like, hey, this is a problem. I want you to be aware of it, and we can do something about it now. And for all three of you, feel free to jump in, any of you. Where do we see the Myopia Collective going? Like, we're just in the beginning stages of it. So what's the goal? Where do we hope to get with the Myopia Collective?
Yeah, I'll start. One of the three pillars is advocacy. So that's where the AOA kind of has their experience and talents to offer as we kind of mentor the change agents and they help each other with legislative advocacy, whether it's inviting an assembly member, senator to their practice or to SUNY to get a quick tour, kind of see what eye care in children is all about, or whether kind of reaching out to your local legislative person and visiting their office you'll probably get a staffer, which is totally fine, but should keep that consistent support. And we've had webinars and sessions for the change agents where, we get advice to, it's a two-way street, right? Don't just be a taker, be a giver, and whatever that legislator's person's priorities are, how does that intersect? And just having our, radar up on things like the Early Detection of Visual Impairment Act, EDVI. And I recently learned of a state Medicaid program. So every state has this. It's the EPSDT, the Early Periodic Screening and Detection. So if there's resources that nobody knows about, we got to tap into them, in the interest of helping these children. I know Shelby mentioned access. That's a huge part of the collective.
Yeah. Shelby, can you go, have you participated in any of these, prospects? Have you talked with anyone, Can you go more into?
Yeah, so we thankfully at SUNY, we have people who keep in constant contact with our local legislators, going to events. We do screening within their communities and things like that. One thing that is definitely a goal is really emphasizing the Myopia Collective in particular. Of course, we've talked to them about early screenings and vision care and New York City is one place that is very unique. And, a lot of our patients that come to SUNY actually come from the outer boroughs. They're not from Manhattan. They're likely going to private practices and things like that. So through, other avenues, such as Cooper Vision does have great programs that allows access for, say, patients that may need it, especially now that it's still out of pocket. We are able to reach a lot further. And so that's definitely, a continued goal is the advocacy and big passion of mine. I recently got my MPH degree. And so, health literacy in general, lots of patients come in that they don't know why. I'll have patients, I've been on Ortho-K for 6 years, and the parents are like, okay, so their myopia is gone, right? Like, we fixed it. And I was like, yeah, you've been on this for so long. So, whether it's patients or legislators, that education piece is really, really important, that I think the Myopia Collective can really fill that gap.
Gotcha. And Tiffany, from a practitioner in your situation, in your clinical experience, how is integration with the Myopia Collective working for you? What does that look like?
I think really it puts us in a position where we get to be leaders in our community. So I've been doing myopia management for a good while now, so it hasn't really changed how I practice. But I went to a couple of dinners last year, and they're like, tell me more. Like, they want to know more. And so it presents a platform where we can actually reach out to other doctors and teach them. And, I had this concept come up at a meeting I was at this weekend where, and I even wrote it down, and I wrote it down for this too, is like collaboration versus competition, right? Mm-hmm. Like, if there's 19 million kids that are myopic that aren't being treated, like, that's not a competition thing. That is like, we need to help more kids. We need to be better at it. So I think, like, advocating for, like, if you don't want to see these kids, that's okay. Like, that's why I'm here. Like, just send them to me. You don't have to do anything. You don't even have to write a report or something. Like, just. But then if you want to do it, like, come visit me. I'm happy to, like, mentor you through the process. I've told many doctors, I'm like, you want to learn how to do Ortho-K? Let's do it. Like, do you want to learn how to do a consult? Let's do it. So for me, I think my role is more of just like, how do I get other doctors to do this? Like, to either know that it's okay to refer and be like, and it's just creates this really cool reciprocal situation. Like, I have no desire to do glaucoma. So I send glaucoma and they send me myopia, and it's like, they love it and I love it. I don't ever want to see those patients. They don't ever want to see these patients. So I think just opening up that dialogue, that it's okay for us all to kind of share patients. We don't have to be everything for every individual patient.
Yeah, it's such a great point. Like, there's so much fear around, like, at least in the past, I know things are changing now, about, OD to OD referral. Paul Levine calls it the biggest crime in optometry, that we are not taking care of the patient and we're not referring them to the specialist that can help them and give them the best treatment. And, what can the Myopia Collective do to kind of cement those connections, to assuage those fears? Because I have seen, especially a lot in the last 3 years, I have seen these kind of dinners that you were mentioning, Tiffany, where it's like, the whole goal is education. And the speaker will usually take the position that you just mentioned, like, hey, I want to tell you about myopia management. I want to teach you some things. And if it's for you, we can take that to the next level. If it's not, you should at least be aware of what's going on. And we've seen a lot of referrals come from ODs who are like, you know what, myopia management's not my thing, and that's okay. So, for any of the guests on the panel, how can the Myopia Collective help with that integration? Is there something official that we can put out into, the greater optometry industry in order to help this along? Justin, why don't you speak to that?
Yeah, I mean, Cooper Vision has like referral paths for other providers, but I think Tiffany sort of spoke to this about kind of demystifying what was, again, maybe more complicated or complex, even as recent as 3-4 years ago. Like, it's simple and it's easier than you might think. For instance, like, we talk to patients about cataracts or computer progressives almost every day. And this myopic conversation could be similar or easier or shorter, but we've never taken the time to kind of practice that 35-second pitch, if you will. So I think the collective can really demystify through our state change agents and through other avenues like our 25 myopia reps and just making aware that there is help. There is help for you. You don't have to train your staff by yourself. There are lots of resources, and I think the human element of each other being a helping hand is really supportive. And I think the accountability, not a lot of people want accountability, but it's like so needed. And it needs to be approachable. I think like my dream is to have like even change agents be that voice of reason, that mentor in like a group text of like 4 doctors. And I think as you kind of share cases and week by week go into patient care and come across things that we all learn together and are better for it, but that we stay in front of each other, that this myopia control thing is top of mind. I think that's where the value of the collective can really shine.
Yeah, I love it. Shelby, can we help our new students and, before they get out into the world of optometry, can we prepare them with the Myopia Collective so that they understand like, hey, you don't have to do myopia management as your specialty. That's totally fine. How do we, I used to call them diamonds in the rough. I've been in this industry for 20 years. We were looking for a very specific kind of person to do myopia management. Now I feel like we can broaden that scope. What are you doing at SUNY to help those students kind of realize their potential?
Yeah, that's a good question. Again, trying to get as many students through the clinic, and then once they're done, they realize like, oh, this isn't nearly as bad as I thought it was. Again, a lot of them already have that interest, which I feel like is oftentimes half the battle. I understand a lot of, graduated optometrists are like, oh, it's a new skill I'd have to learn. And they feel like it's this huge barrier to overcome. But especially while these students are already in learning mode, this is very, not a lot they have to go on. The contact lens patients that they see in our contact lens clinic are way more complicated than most of these myopic patients, I should say. And so this, I feel like, is a lot more low-hanging fruit, and letting them know, again, if they're going to stay in the New York area, they have us to refer to. There are a lot of other doctors in the area that do it. So providing the resources of, hey, if you are not comfortable doing it, or maybe you only want to do some of it, you don't want to do ortho-K because that feels too much. But let's review the literature of atropine and soft multifocals, and then you're going to refer your, ortho-K patients. So kind of meeting them where they're at a little bit while still pushing them to, again, whether they're doing it or they're referring, and hopefully taking that with them wherever they go.
What's really cool, Matt, we were just with 50 student leaders over the weekend, and 5 of them wear Paragon CRT. And maybe next year's first year class, they might be a first-year student wearing my sight. Like this is something they've lived through now. And as providers, they can talk to their patients that this has been my personal experience. And I think that's going to be really, really fun, really exciting.
In our first year class, we have a handful of students that wear ortho-K lenses. Yeah. And definitely when I was a student, I felt like that wasn't the case. None of my classmates wore them. So.
Right.
I really like what you said about them having this ability to stop and not have like the low hanging fruit, right? Like, so they don't have to treat everyone. I think of it like glaucoma. And like, I can do glaucoma and I could do the evaluation. And like, if they saw them progressing at a rate where you're like, oh God, am I not doing it? It's what I'm not. And that's the patient they could refer. Yeah. Right. And then that gets them started, and then they get their feet wet, and they're like, oh, this isn't so bad. So, I mean, I think presenting it like that to doctors, I think would be really helpful too. It's just like, let's, start with some insights. Let's start with some easy things. Like, you're feeding contacts anyways. Let's put these lenses on them and see how they do. And then if they're still progressing, then like, let's do something else.
Yeah.
No, that's so true. I've actually gotten a couple referrals recently from outside ODs that, it got to be a little complicated. They're like, I don't know why this is happening. The fit to me looks okay. What do you think? And so it is really nice that, okay, I'm glad that they're doing it. And then when they need help, they recognize that. And like, it's a collaborative thing. So.
Definitely. Yeah, I love it. And Tiffany, how are we helping? Because I saw you nodding a lot when Shelby was describing the students. And I love this era that we're in now, where we have a lot of docs who previously may not have considered myopia management as a specialty, or even having the conversation? What are we doing to help progress those docs who have, just now considering it? You've been doing it for a while now. You're become an expert in, myopia management. Specifically, you mentioned Ortho-K. I'm a fan of whatever's treating the patient. How do we progress that doctor who's interested into a myopia management specialist?
There's meetings and then there's mentors, right? So I think the collective agency, that's why I signed up for it, because I'm not go to my legislator. I'll do it if they make me, but I probably won't do it unless they make me. For me, it's really more, but I would love to educate other doctors. And so having just people that they can go to and be like, hey, I had a doctor who mentored me for 2 years on fitting Ortho-K lenses, right? And so now I'm really comfortable. But when I wasn't comfortable, I had him there to kind of hold my hand through the process. So I was still able to treat people even before I was ready. And I think there's a lot of practitioners out there that would be willing to be like, hey, let's do this. Let's learn together. And, if you start it and you have questions, then reach out. And Zoom, oh my God, how much does it change how well we're able to learn, right? Because the doctor who mentored me, he's in Florida.
Ireland.
Right? But I got to meet with him once a week, and we did that for 2 years until I was like, okay, I don't think I need this as much anymore.
Right.
Yeah, we have so many opportunities for anyone to learn, I think. And the collective agency puts this group of willing doctors in front of them to be like, here you go. Here's a bunch of doctors that are willing to help you.
That's all.
Matt, I'll share a quick story. A year ago at SECO, we had a dinner, and there was this residency trained doctor. She felt so much guilt. She's like, I haven't helped any of my kiddos with myopia for the past 4 years, and I'm residency trained. But then her rep, fantastic, Carolyn, encouraging her, don't worry about the past. It's all about the present, and let's just start. And then sure enough, the 5 days after, this doctor texted the rep and said, just with my first MySight patient, the patient's mom didn't even blink an eye. There was no resistance. It was all kind of in her head that it was going to be too expensive and that there would be hesitation. And you do it enough, you'll get yeses, nos, not sures. I'll think about it. But surprisingly, the confidence of the doctor leading is going to drive a lot of conversion. I think more than we might think sometimes.
Justin, can I throw something out there? I just read this. I read 2 books, but they were on kind of negotiation. And both of them go through this concept of how powerful and empowering it is for the patient for them to be able to say no. So it's we're actually looking for a no. And we can actually get to the place where we can find out why they're no. Is it too scary because I've never heard of it? Does it cost too much? And instead we just make these assumptions on our head that, it's cost too much, I'm not going to present it. When most of the time that's really not that's not their pain point. Maybe it's they can't come here every 3 months. Okay, come in 6 months. I don't care. I'm trying to take better care of them, but they're still being helped if they come in 6 months. So
yeah, absolutely.
That's such a great point. I mean, I grew up in an Ortho-K practice, and we were taught, look, there's going to be no's. We worked on patients back then for 5 years before we saw a conversion. That was our average rate. So no's were just part of the job. And I tell people all the time, there's low hanging fruit when it comes to rejection, especially for a parent that is just finding this out for the first time or is just having to come to terms with it. It's usually mom. And they're telling her about the situation, what her child is going through, what we can do about it. And it's just all this new stress added to her life. And she has so much to deal with just normally. And so the rejections that start coming up are the easy ones to throw up because they want to make sure you are prepared and ready to do that job. And so it's easy to say, well, the cost is too much because that's a low-hanging fruit of rejection. So, and any of you can answer this, but what are we doing to help that process along? Does the Myopia Collective have resources to help give the practitioner, some help to get past those early obstacles of look, you're going to get rejections and that's okay.
Yeah, I think it was a core theme of the Change Agent workshop that we brought the Change Agents together last September, where the very first night we all kind of shared in small groups. We called it a spectacular fail, but basically, how did you like screw up a conversation, mess up in myopia control, whether you saved it or not, just like being very open. Like it was very humanizing that we all make mistakes as we deliver care. That's why it's called clinical practice, right? And then setting that up to the next day where we kind of, again, discuss in small groups things that parents might say to us regarding, like Tiffany said, never heard about this before, or they're too expensive, or is my child too young for contact lenses? And just working out how do we effectively respond to some of these things or get ahead of it. So we know that people are coming from a place of skepticism, anytime it's new. So kind of preparing for that, and also, just having a FAQ sheet, that people can refer back to and staff could be trained on. Because I think we've heard a lot that a good staff member is going to answer questions from parents the same way the doctor might. And in fact, a lot of families spend more time with the staff are going to spend more time with the families than the doctor might as well.
Yeah, for sure. Shelby. Oh, go ahead. Go ahead, Tiffany.
I was just going to say, pain points, right? So, if you have a parent or two parents who are myopic, then it's like they know what it's like to be myopic. And so it's a lot easier. So, if you find the pain points for them, like maybe they don't understand that we want that eye to be shorter, but maybe their child is really into baseball. And we can come at it from that perspective. So like listening to them and figuring out what's important to them can be really helpful for us to be like, okay, well, let's meet them where they are and have that conversation. I think that would be really powerful.
Yeah. Shelby, do you agree with that? I mean, how do you handle rejection in your clinic? How do you teach, the next generation how to handle this important aspect of a myopia management practice?
Yeah. So one thing is, I get to be in the clinic. These patients have agreed to at least come to a consult. So they've usually heard a little bit about it. When I'm in the pediatrics clinic, that's where I get to try to really do more of the convincing. Most of the time, once they get to the clinic, I feel like it doesn't take much. It's more just answering questions, encouraging them of which option might be best for them. But really in the peds clinic and working with my colleagues in pediatrics and trying to get them to really educate, they're very aware of it. They're very pro myopia treatment, but just those little ones where, they might throw up a little bit of hesitation and then they just completely back off. So it's like, give them all of the information. It's okay if they try to bring something up. If it is okay, like Tiffany mentioned, like what is the pain point, trying to meet them where they're at. I find personally the hyperopic parents or the ones that really are maybe a low myope, they are just immediately, they don't get it. And I had one mom during residency. She was, low hyperope, and I showed her +2s to simulate like a -2 uncorrected myope, which her son was because he had never worn glasses before. And she agreed to go into ortho K. Every week she would come in and she would be weeping because she was like, I can't believe I let it go on this long. I'm trying to encourage her, like, you're here now. That's what's important. But demonstration can be really, really impactful and really powerful. And whether it's, resources online or a lot of, axial length machines have those demos now of the curves. Like if you leave them untreated, this is where it could end up. And so seeing it visually can be really impactful as well. I would say our clinic probably the most, just again, with our diverse patient base, cost can be a thing. But if you're able to really, they're willing to go out there and spend the money on braces for their kids. And, these parents will do what they need to for their kids. So it really comes down to showing them why it's so important for them to consider it. And again, we get a lot of no's, and okay, we'll talk about it again in 6 months. So
yeah, there's a lot of children's hospitals throughout the country where 90% of the patient base is on Medicaid, and these ODs and pediatric ophthalmologists as a team, they're finding a lot of kids and families going into my site, and I think it's again communicating the value. And maybe sometimes culturally or for whatever reason, like they're pretty scrappy. They'll find a way. They'll ask grandparents to pitch in some money to help. And they actually get started sooner than later. So when you look at like Bascom Palmer or Duke University or Cincinnati Children's, MiSight is taking off in those places where, again, 90% of the population is Medicaid.
Yeah. Yeah, definitely. And go ahead. Yeah.
I was just going to say payment plans have been a game changer for us. Like
Really?
some access and just such a like so much easier to say yes because they're like, oh, that much per month. Well, I could do that. Right. And so then it takes off this big sticker shock and it just sit down. And, you know, for me, I just want to make sure I'm covering my overhead and making sure that like I have a sustainable business. Yeah. And so if it comes in like trickles in versus comes in all at once, like that, it helps them a lot.
Yeah, that's a lot easier for a parent to wrap their head around, you know, when you start putting these things in front of them. This is a big deal and this is why you need to take it seriously. And we have solutions now that we didn't have before. And there's so much shyness around charging appropriately. I don't know why that is. I come from a family of optometrists. My great-great-grandfather started doing optometry at a jewelry store. Wow. And I feel like, do we have like, is that our curse in this industry that we're afraid to be salespeople? Yeah. Why is that? Like you need to charge appropriately in order to do myopia management. I say all the time, if we were giving this away for free, nobody would do it. You know, and there's stories of orthokeratologists who have done those charity cases, and those are the patients that always drop out because the parents have no skin in the game.
Exactly. There has to be some accountability. Yep.
Yeah. For sure. How do we? Is the Myopia Collective, you know, raising awareness for the public? Is that something to help, you know, provide some support to the optometrists, to their staff, their myopia coordinators, anybody, the ophthalmologists, anybody who wants to do myopia management? Is that something that's happening, and if not, is that something on the horizon? Justin, what do you think?
Yeah, you know, we have those resources again to kind of promote those healthcare providers in the community, pediatricians primarily, but certainly pediatric ophthalmology. There's only 1,000 of them, and they're only in 10% of all U.S. counties, but there's still an authority along with the pediatricians. So building those relationships is definitely foundational to the Myopia Collective and what the change agents would probably want to do as their kind of role and their authority in their states, because all 50 states have a change agent, which is really cool. But yeah, we definitely want to raise awareness, but there isn't really kind of marketing dollars there. But we did actually, I want to plug an article that we kind of wrote together that's on review of myopia management. And it's all about how do we get the children of our adult patients in for an eye exam? Because if every adult, if half of every adult has 1.94 kids, that's a huge pipeline of children that's not being reached right now. And just like Shelby said, like there's a lot of kids where their first eye exam, they're -2, 225. I hear it all the time. Why isn't their first eye exam -1 or +1/4? Because yes, optometry is a marketing problem that somehow the public doesn't see vision as valuable as other things. And so it's a more reactive, like, oh, if they're terribly symptomatic or the teacher finally notices they're squinting, but we should obviously get much farther ahead of that. So I think we've definitely written a couple of articles that might guide doctors into both how to work with pediatricians, but also how do you just create a system? How do you create some habits in the practice to actually get every child of every adult patient? Because you've already built that trust, and that's going to be far more valuable getting those kiddos in than trying to reach random new kiddos in your zip code.
Yeah.
I'm getting more people to understand vision and like more professional allies, right? So people outside of optometry, like you just said that most people don't understand that vision is so important, but like vision is our dominant sense, right? Like there are more places in the brain that go to vision than to all of the other senses combined. Yeah. That's how important it is to our biology. Like how is this not important? So yeah, we do need to do a better job advocating, but I think going to different professionals too and just having them understand what we do, because they already get it. Like they understand medical and they understand the model. And so it's a little bit easier, I think, for that than to try and educate the global public. Right?
Yeah.
Right. Yeah.
One at a time.
Yeah. And dentistry has this on lockdown, like when it comes to your kids' teeth, you're thinking at least by 3 years of age, you're thinking dentist, right?
Mm-hmm.
And look, I've been to the dentist. I had braces. I love my smile. But if you were like, hey, your smile or your vision, I'm going to take my vision every single time.
Yeah.
And, when I work with practices and go in, I talk with staff and the doctors and I say, dentistry figured this out somehow, and we can too, because we're not poking sharp objects into these kids' eyes. We're not making them sit there and take x-rays with a lead vest or whatever it is on their chest, like making them feel like they're suffocating, or at least that's my experience. Maybe this is something about me. I don't know. But what I'm trying to say is, we have the advantage in optometry and we should be advancing that. I think it's important for the Myopia Collective to be a big part of that process, to let the public know, hey, this is what you should be doing for your child. And this is how we can address these problems. The Surgeon General, I was listening to an interview the other day, and they were saying like kids spend on average 4 hours on social media alone. Social media alone. That's not any of their other screen time. That's just social media.
Oh, wow.
And it's like, even the Surgeon General knows this is a problem.
Yeah.
So we need to redouble our efforts. And speaking of which, how involved, like, what is the Myopia Collective's position on the science? Because I think this is something we definitely need to rally around. Back in the day, it was like the studies were being done, and the pioneer generation of orthokeratologists, the James Kirk generation, I guess, were like, we're just going to do this. We've seen the results in clinic. We know it's working. We know it's helping the patient, and we'll let the studies catch up. And now I feel like we have the science. So, Justin, let's start with you.
Yeah.
What is the Myopia Collective doing with the science? How are we integrating that into the Myopia Collective?
Yeah, certainly its supervision and AOA stance that evidence-based practice is the most important way to take care of patients. It was with that information. It's changing so much, right? Studies are coming out just about every day throughout the world, and it's a lot to catch up on. So while the evidence is important, it's not like it's not the Myopia Collective's sort of mission to bring science forward in just like paper by paper or summaries or guidelines per se, because we know that what will change behavior actually is powerful voices like Tiffany and Shelby. It's actually feeling like you're part of the herd. And that's exactly what the collective is. Like, joining this is not like, it's not like you don't want to be left behind. Certainly that's not a good feeling, but you want to be part of the positivity of having a really great time when the kids come into your practice after school, and just having a happier, job satisfaction, even within optometry. And I think that positivity is actually what's more needed to change the behavior of ODs.
Yeah, I agree. All right, I want to end on a couple of things, but is there anything else we want to mention that I might have missed about the Myopia Collective? If not, then I think we'll go to just what I really want to do is, in the past, myopia specifically in optometry was dominated by men, and now optometry and myopia is dominated by women. And I think this is a very important time where women are going to be the decision makers of how this moves forward. And I think that is a very exciting time for us to be in, because in my experience, women have done very well with myopia management, have really made it their own. So Shelby, we're going to start with you, and Tiffany, we're going to go to you after that. What kind of message can we give the next generation of optometrists, regardless of gender or orientation or whatever the case may be? What kind of message can we give them moving forward about myopia management and the Myopia Collective? So Shelby, we'll start with you.
Yeah, I think really the message that, like you mentioned, with dental, like they had such a strong force where everyone was on the same page. And so getting on that same page with everyone, I think first and foremost, where the Myopia Collective really comes in, it's going to need to be, across professions, and really within optometry, really driving it home that this should be the standard of care. And so I think just as students are able to see that collaboration amongst, other professions and referrals within the profession as well, will really just drive home the point that this is where, I think they already do realize that this is where the profession is heading, and this is a really great practice builder. And as long as they're comfortable seeing kids, they're willing to do it. But just staying engaged, involved, and the Myopia Collective really helps bring that home.
Right. Awesome. And Tiffany, same question. What can we do for the next generation to get them interested in myopia management and the Myopia Collective? What do you think?
I mean, I agree. I think it's more just getting them. Well, so I was thinking about it when you said that, and I was thinking that it goes down to the same question, like, why aren't they doing it? And I think everybody probably has different pain points. So Shelby touched on the fact that maybe it's like a fear thing, like maybe they're not really comfortable in it, in which case, like, having the collective be like a place where they can come and feel like they can say that safely, like, I don't know what I'm doing, but I want to do this, and have just that person who can like hold their hand through it a little bit. So I mean, I think creating that group of people who can be like, yes, I will help you through this would be really helpful. Taking it out of like especially and be like, yes, there are specialists in glaucoma, and I love that they're there. I don't know why I use glaucoma because I hate glaucoma, but there are specialists in other things that like retina. Like, I can look at a retina and I can tell you if it's good or bad, and I can tell you when I need to refer. But I'm so happy that the retinal specialists are there. So taking myopia from a perspective of like simplifying it, it's not hard. It's like, it's contact lenses, it's eye drops, like it's a conversation with them. And I think for me too, I think the biggest thing that was helpful for me when I was like, oh, I'll do this, was when I realized that it actually works, right? Like, so the fact that it's like, we do this and it is slowing down their myopia, like, who wouldn't want to do that? Like, and if you go into a room full of MDs or ODs or any other Ds, like, we're all myopic. Like, every one of us. So like, we all understand what it's like. Like, if this could have been available for us when we were little, like, wouldn't you have jumped on it? So why would you ever withhold that from anybody? So it's just like helping them to find their why in it, I think would be really important.
Yeah, I think that's a great point. So much of it, in my experience, is about having a passion, for myopia management. And I always say you cannot teach passion, but you can definitely learn it. You can learn your own passion for myopia management. And I think that, I love what both of you said. Justin, from industry perspective, what kind of messaging can we put forth to, the greater industry as a whole about why they should do myopia management?
Yeah, I mean, just start, just join. You don't have to think too hard about it. Like, it's, as I mentioned, the standard of care was already declared by the World Council of Optometry 4 years ago. But I love what you said, Matt, about that passion, because it doesn't happen overnight. Like, if you start, then your first patient is going to add a little bit of passion. Then the second will add more. And then it just keeps building. And then we've heard word of mouth referrals come as quickly as a week sometimes, which is like something that's not really talked about. But like, that's the best practice builder, is that word of mouth referral. And then it becomes, again, more fun and more exciting. So I think with the Myopia Collective, we just gotta, again, stay consistent. We need accountability. We got to demystify and just say, hey, you could wait to start doing this, but don't wait too long, because the need is greater than ever. And at the end of the day, just thinking about visual impairment from myopic maculopathy, there's going to be about 3.5 million with visual impairments in the US by the year 2050 due to myopia. And comparing back to Tiffany's glaucoma example, only 1 million from glaucoma. So myopia is 3.5 times more problematic when you think about visual impairment. But yeah, at the end of the day, I bring it back to the people, because it's people over projects, right? And that's what really matters. And I have the privilege of being a parent of a second and first grader in 6 years old. And I think like doctors need to just like hit pause sometimes and put themselves in the shoes of a second, third, fourth grader and realize, like, how does their 16-hour day look like? And how does myopia control can make that so much better? because we hear the stories, but those stories need to be shared out as often as we can.
Yeah. Yeah. And that is the whole point of this podcast, because myopia management is awesome. I love it. The people in this industry are very special. And this panel is no exception to that. Thank you, all three of you. This has been an absolute delight to have you on. And that's what I want to do, is share the perspectives and the personalities and the life experiences of those who are doing myopia management. It's super important. Tiffany, if anyone wants to find out more information about you on the internet, how can they do so?
You Google me. I don't. I mean, I can share my email address. I'd be happy to answer.
Yeah, if you feel comfortable. Yeah, sure.
Yeah. Go ahead. Did you want me to like verbally say it?
Yes, please. Yeah.
Tiffany Martinez OD@gmail.com.
Easy enough.
And Shelby, same for you. If anybody's interested in anything you had to say, have questions for you, want to get in touch with you.
Absolutely. Email sjohnson@sunyOpt, SUNYOPT.edu, or reach out on LinkedIn as well.
Fantastic. And Justin, anyone wants to get in touch with you about anything we've talked about in this episode, how can they do so?
Sure. jquan@coopervision.com. And then, same. You can DM me on LinkedIn, Instagram, Facebook, you name it.
And if we've got somebody who's interested in knowing more about the Myopia Collective, Justin, how should they search that out?
Yeah. Google search just AOA Myopia Collective, and it'll be the top link, and you can jump right in. There'll be 4 kind of blue rectangles once you scroll down a little bit. One of them is to join and be a member. So I encourage all of you to join. We're about 4,000 members strong. We would love to get to 10,000. That's going to just make our collective voice that much more powerful, not only in legislation and advocacy, but just to the public as well. But yeah, there's a lot of resources on the AOA Myopia Collective website.
Awesome. Well, the three of you, thank you so much for joining me. I feel truly honored to have each of you on. I always want to have great personalities on the podcast, and the three of you have definitely, showed us a lot about who you are and why this is important to you. So thank you so much for everything that you're doing and coming on the show. I would love to have each of you on separately and together in other episodes if you're up for it.
Yeah.
There's a variety of topics that I would love to talk with each of you about. So thank you so much. And for everybody else, we'll see you at the next one.
Thanks for having us.
Thank you.
Thanks, Matt.